Hello, everyone. Thank you for joining us today. Sorry we had a little bit of a delay this morning wrapping up a last-minute patient, but I'm going to hand you guys over to Dr. McMillin here. He's going to go over kind of the top 10 questions here about LASIK that we hear about over here at Campbell Cunningham Laser Center. Just a quick admin note, if you have any questions during the presentation, please feel free to write those questions on the right-hand side of your screen in the GoToWebinar menu. You should see a tab that says questions. Any questions you have throughout the process here, feel free to write those in that tab, and then at the end of the presentation, we'll go ahead and ask Dr. McMillin those questions and get those answers for you. So without further ado, I'm going to hand it over to Dr. McMillin, and on to you.
All right, well, thanks for joining us this afternoon. We're just going to run through some of the common things that patients seem to ask about LASIK and see if we can answer some of your questions. We are at the very last slide. Let me just go back to the start. There we go. All right, so patients have a lot of questions when they come in for evaluation, and some of these things are things they've heard from friends and family members. Some of them are true, some of them are not so true, and I'm going to try to give you just a really honest and straightforward kind of assessment of what I think about and the things I want you to know when you come to see us for LASIK treatment. It's a big decision, and it's something that we take really serious. And it's my job to make sure that you guys understand, the options, what we can do for you, what we can't do for you, and what's realistic. And so I kind of see this as us working together to achieve the goal of really good vision for you. The first thing to understand is that not all vision correction is LASIK. LASIK is definitely the most commonly performed laser vision correction procedure, but in the world of what we call refractive surgery, there's a number of options, and there's a lot of different ways that I can help you with your vision, and LASIK is one of them, but I might recommend something else. And so just in general, when you hear about LASIK, this is laser vision correction with a flap, and a flap is a surgical term that we talk about with LASIK. PRK is very, very similar to LASIK, but it's laser vision correction without a flap. The flap is what makes LASIK unique and what gives LASIK a very fast recovery and minimal discomfort. However, PRK is the right decision for some people. A refractive lens exchange, that's when we actually don't use a laser, but we use ultrasound to remove the lens inside the eye and use an intraocular lens implant. This is a great option for folks that are in their later 40s and different situations that we would talk about that particular procedure in. Now, some patients are not candidates for LASIK or PRK, and usually it's because they have a really high prescription. And those patients will often recommend what's called an implantable Collamer lens. And this is like an implanted contact lens that stays in the eye throughout your adulthood until you develop a cataract, probably in your 50s or 60s, and then that lens is removed at the time of cataract surgery. So for some people who are not laser vision correction candidates, either a refractive lens exchange or an implantable Collamer lens is the right choice. It's important that we understand the eye anatomy if we're going to talk about LASIK. And so the cornea is the front part of the eye. That's really the window to the eye. And when we do LASIK and PRK, we're working on the cornea. We're reshaping the cornea. When we talk about a refractive lens exchange, we're talking about replacing the lens inside the eye. The eye is just like a camera, so the light enters the front part of the eye. It gets bent and focused by both the cornea and the lens, and then focused onto the retina. So our goal in refractive surgery is to optimize your eye so that the front part of the eye focuses the light appropriately to the back. So the number one question, how do I know if I'm a good candidate for LASIK? So if we're going to talk about who's a good candidate, probably the best way to decide is who should not have LASIK. And when I meet you for a consultation, my job is to find out if you shouldn't have LASIK. And if I go through all the testing and look at you really closely and I can't find any reason not to do LASIK for you, then you're a good candidate. So things that I'm looking for, if your glasses prescription is changing. So if you're changing from year to year, we don't want to do LASIK because you may continue to change. If you have any known disease of the cornea, things like keratoconus, if you've had severe eye infections in the past, if you have corneal swelling or abnormal blood vessels in the cornea, all things I'm looking for. If your corneas are abnormally thin, we have to have normal or thick corneas to do LASIK. If you have cataracts, if you have uncontrolled glaucoma or uncontrolled external disease, and by that I mean dry eye, eye allergies, things like that. Now, mild dryness, mild allergy are okay, but if there's severe dry eye, LASIK and PRK can make those things worse. If you have uncontrolled autoimmune diseases, things like rheumatoid arthritis or lupus, those are certainly contraindications. The next thing is if you have unrealistic expectations. Now, we can certainly help people see better, but vision beyond what you achieve in a contact lens, if you're not happy with your vision in well-fitted, appropriately measured contact lenses, we really cannot improve beyond that with LASIK surgery. So it's important that we understand that, as a young person, the vision you have with a contact lens, that's the vision we're trying to get with LASIK. If you're under 20 years old, that's sort of a rough guideline. Now, occasionally we'll do 18 and 19-year-old patients who have really stable glasses prescriptions, but in general, we try to keep the patients about 20 years or older. Pregnant or breastfeeding, those things can affect the healing. Or if there's significant psychiatric disease, we know that patients with severe untreated depression can have a hard time with LASIK recovery and vision difficulties. So we want to make sure that those things are all adequately treated before we move forward with LASIK. So if you don't have any of those things, most people don't have these things, then you may be a good candidate for LASIK. So what happens at a consultation? So the first thing is that you're going to receive a phone call, likely if you're referred to our office, from our laser center director, who's going to go through a lot of screening questions with you. And she's going to help catch if there are anything that's blatantly makes you not a good candidate. And that way you don't have to waste any time with coming to the office and taking time out of your day and off work for a consultation. If there's something like uncontrolled autoimmune diseases that we know of or something like that, we can roll you out beforehand. The next part is you're going to come in for a complete eye exam, and this is probably a longer, more detailed eye exam than you ever had in your life. It's going to take a couple hours. You're going to have your glasses prescription checked multiple ways, both dilated and undilated. You're going to make sure you're out of your contact lenses for at least a week before your appointment. You're going to see one of our optometrists who's going to do some checking your glasses prescriptions. You're going to see our technician who's going to in multiple ways measure your eye, and then you're going to see myself or one of our other LASIK surgeons who's going to go through whether you're a good candidate. We're going to talk to you in depth about your goals, the risks, benefits, and alternatives to LASIK, and we're going to discuss your expectations. If everything checks out and we're happy with the measurements, then we can proceed with surgery. So question number 3 is sort of all in one, is what is LASIK like? Does it hurt, and am I awake? So those are all usually lumped into one. So the experience of LASIK is that you come into our office-based laser suite. Now we have this exact laser suite. It looks exactly like this picture. There's a flat bed there, and we use both of these lasers to do the treatment. So it takes 2 different types of lasers to do the treatment. We give you some oral relaxing medication to take the edge off, make you comfortable, and then we use topical numbing medication. The procedure takes about 15 minutes. During the procedure, people will tell me that they feel a lot of pressure and their vision is invariably blurred during the procedure, okay? People will often say, is LASIK painless? And I think that's a little bit disingenuous. I don't think that LASIK surgery is completely painless. But I also don't think it's a painful experience. Patients will tell you that, yeah, there was pressure. I had some things that were not the most comfortable thing I experienced that day, but it's not something that they say, oh, that was the most painful experience of my life. Certainly the outcome is worth the maybe some small amount of discomfort during the procedure, but it's not something that is overly a painful experience for patients. The eye is numb, and so it's more pressure than anything. And yes, you are awake. We do need you to look at certain lights during the procedure. Some important things to know is that our laser center, these lasers or some sort of laser, have been in our office for 20 plus years. And these lasers don't move. These lasers stay in the same room. They're calibrated every day. The humidity is checked. The temperature is checked. This is all very, very precise instrumentation that stays in the same spot every day. Question number 4, does insurance cover LASIK? And unfortunately, that is no, pretty much across the board. LASIK is considered an elective procedure. It's designed to improve the quality of your life. Certainly, you can achieve good or acceptable vision with glasses or contacts. We know that there are risks with contacts, things like infections, and so I think the LASIK does offer some considerable improvement in your quality of life. There is financing available that you can talk to our office about if that's something that you're interested in. Will I need glasses after LASIK? So, of course, the reason you come to our office for LASIK is to get out of glasses. However, there are times when patients may need glasses after LASIK, depending on your eyes. So why might you still need glasses? If you are over the age of 45, or you're already using a bifocal or reading glasses, LASIK will not fix your reading vision. It will make your distance vision clear, but you will need reading glasses just like you did before LASIK. You may not need the bifocal because your distance vision is good, but you will need reading glasses. Now, there is a strategy called monovision where we use one eye for distance and one eye for near. And that is a strategy where patients can get out of glasses if they're over the age of 45. And I do normally recommend we at least try monovision with a contact lens if you're 45 or older, because we know that you want to reduce your dependence on glasses. So that is something that we'll discuss with you. Now, if you have an under or over response to treatment, just about everyone has the same healing pattern. In some small percentage of people, they will under or over heal. And after surgery, they may find that a small, thin pair of glasses makes things a little bit sharper. Now, some people are not bothered by that and they go on without glasses. Some people find that they do appreciate that the glasses make it clear. And in those people, those may be people that have a secondary laser treatment to take care of the small amount of residual glasses prescription. And that's something that we can talk in detail about during a consultation. Now, the most common reason our patients wear glasses is they want to wear over-the-counter sunglasses. I can't tell you how many patients leave our office after LASIK and they go buy non-prescription sunglasses over the counter, something they've never been able to do in their life. And I think sometimes they're more excited about that than anything. Question 6. I already wear reading glasses or bifocals. Can I still have LASIK? So this is a little bit of what we talked about in question 5. But yes, you can still have LASIK. But you will need reading glasses after LASIK if you are at the age of needing glasses or bifocals. And again, monovision, which is one eye for distance, one eye for reading, can reduce the need for readers. And we always, if you haven't done that strategy before, we always bring you in the office and let you try it in a contact lens to make sure that your brain will adjust to that type of vision before we do it surgically. Question number 7, does LASIK wear off? The LASIK treatment does not wear off. However, your eyes can change over time. You're a living, breathing human being, and just like everything else in your body, as you age, your eyes can change. Most people, their eyes stay the same after LASIK during their 30s. Most patients probably have LASIK on average in their 30s. Throughout their 30s and 40s, their eyes will stay mostly the same. However, in the late 40s, you will start to lose your reading vision. And some people will think that their LASIK is wearing off because they're needing reading glasses, and that's not really true. It's more of a natural aging process. Now, Some patients, when they start to develop cataracts in their 50s or 60s, that's when the glasses prescription may change again. And it's not because the LASIK has worn off or your cornea is changing. It's because the natural lens inside your eye is changing. And that can lead to the need for glasses again in that time of life as you're older. And then certainly if you develop any sort of eye disease, something like macular degeneration or glaucoma or dry eyes, things like that, those things can all lead to, feeling like your vision isn't as sharp as when you first had LASIK. Question number 8, how long after surgery will it be before I can see? So right after surgery, some patients are already noticing that without their glasses, things are actually a little more clear. Now, it typically takes a couple days and up to a few weeks for your vision to fully settle in. Right after surgery, there can be some things in the vision like glare and things that you see right the first couple of days, and those things usually get better, some fogginess. But in general, within a day or two, most patients are noticing significantly improved vision with LASIK. And by about a month out, we sort of know where we've landed in terms of how well your LASIK treatment has worked for you. But I don't get worried if a patient has some blurry vision the first couple weeks, because it normally settles out over time. What are the restrictions after surgery? So the day after surgery, I ask that you go home and you take a really long nap. That's arguably the most important part of your healing process, is to go home and close your eyes, because your eyes are going to be light sensitive. They're going to be watery. You're going to feel maybe a little bit grainy that first day. Most people can return to work and normal activities within a couple days. Everyone's a little bit different. I think that it's reasonable to take the day after LASIK off of work. And depending on your job, you can likely go back within a couple days. However, everyone's a little bit different, and you have to know yourself. And if you need more time off of work, then it's certainly worth taking it based on maybe some of your previous experiences with surgery and things. We ask that you stay out of water as far as like swimming in hot tubs for 2 weeks. So if it's in the summertime, we don't want you going underwater, submerging your eye in water for a couple weeks, and no eye makeup for at least 1 week. And the big one is no eye rubbing. People have problems immediately after surgery. It's often because they've rubbed their eyes. And so we give you some shields, little plastic shields to wear over the eyes that you sleep with at night for the first week, and just ask you to be careful that first week about rubbing. Question number 10. So what if I'm not a LASIK candidate? Are there other options? And there definitely are. About 20% of patients that I see, I end up recommending something else. Sometimes that's PRK, which is a great procedure and works really well. Sometimes that's a refractive lens exchange, where we take out the lens and put a lens implant in the eye. And sometimes that's an implantable Collamer lens. We call those ICLs, and that's another option. Just know that if I'm not recommending LASIK, it's because it's the best thing for you. And I'm not going to offer you something that I wouldn't offer myself or my family member. And so I think that's really important to know, that my job is to evaluate you, look at the available technologies, and match your eyes with the technology that's going to give you the best result. And I will recommend what I think is appropriate. Sometimes I'll recommend no surgery, and that's also in your best interest. So depending on your eye, some eyes are not made to have refractive surgery, and you may still have to wear glasses or contacts. But if it's the right thing for you, we'll certainly match you with the correct technology. So if you'd like to talk more about LASIK or come into our office for a consultation, you can schedule a consultation with us. Here it says an hour appointment. I know I said 2 hours earlier. I think it's more like 2 hours. So you want to make sure that you've got time to be in the office with us for a little while. So call, schedule an appointment, and we can certainly take care of you and give you our best recommendations. So at this point, if there are any other questions, I'm happy to answer those.
Thanks, Dr. McMillin. We appreciate it. That was a great presentation, and I'll kind of open up the field here if anybody has any questions, anything that was reviewed here so far. I'll let you guys answer those. Just real quick, Dr. McMillin, since we're in the middle of end of year and flex plan and HSA, is that something that patients can use to cover a portion of the cost of the procedure or the complete cost of the procedure using those HSA and FSA plans?
Yes, it is my understanding that most of these types of plans can be applied to LASIK. If you have one of these types of plans and you're interested in using it for LASIK, that's a great question to bring up when you come for your consultation and discuss with our laser center director when she brings you in for a consultation. But yes, just like you can use your HSA for prescription glasses and things like that, you can apply them to refractive surgery.
Great. Well, I don't think we have any questions populating here. So with that, Dr. McMillin, we'll let you get back to taking care of patients. And if anybody has any questions or wants to review this webinar or send it to friends, you will receive a copy of this recording here. As soon as we're wrapped up, we'll get that loaded and taken care of and emailed out to you. So thank you, everybody, for attending today. We appreciate your time, and we hope to meet you soon. Thank you, Dr. McMillin.
Thank you. Have a good day.
Take care.